How is it that we find ourselves surrounded by such complexity, such elegance?
The genes of you and me, the genes of you and me, are all made of DNA. We're all made of the same chemical DNA. We're all made of DNA.
Hi, you're listening to DNA Today, a podcast and radio show where we discover new advances in the world of genetics. From genetic technology like CRISPR to rare diseases to new research, we have you covered. For a decade, DNA Today has brought you the voices of leaders in genetics. I'm Keira Deneen. I'm a certified genetic counselor and your host. Joining me to talk about pharmacogenomics is Gregory Kellog, the Director of Genetic Counseling at Fulgent Genetics. Thank you so much, Greg, for joining us on the show to dive into a newer area of genetics, pharmacogenomics.
Thank you so much for having me on. PGX is something I'm pretty passionate about and love to talk about, so excited to be on the show to discuss it with you.
Let's just dive in by starting with a little bit of background. So when we say pharmacogenomics, what are we referring to? Because this might be a newer term for some people, especially if they're not as in tune to genetics as we are working in the field.
Yeah, so pharmacogenomics basically relates to using people's genetic variation to kind of predict how they'll respond to different medications. It's pretty well understood in medicine that different people will have kind of different responses to the same medication, even the same dosage, and pharmacogenomics is one of the ways to kind of explain that variation. And by performing PGX testing, we can hope to optimize a patient's medication regimen, make it more efficacious for them, and reduce the likelihood of adverse events.
So there's a lot that goes into it. It's not just a report that says you should take this drug or that. There's levels to it. So you kind of mentioned a few of them, but to dive into it a little bit deeper, what are the aspects of like metabolizing drugs that pharmacogenomic screening evaluates? Like, is there certain areas that it goes through? Like you mentioned, like, how much of a drug someone should take as opposed to someone else.
Yeah, so when we're talking about PGX genes, most of these are genes that are related to breaking down different chemical compounds as they come into your body. So when you take a medication, it either needs to be activated by your body to its active form so it can do the job it's supposed to do, or it enters your body in its active form and needs to be broken down and excreted. So what happens with pharmacogenomic variation is that some people metabolize drugs either more quickly or more slowly. So if it's a drug that you're metabolizing too quickly, you're breaking it down and excreting it, you might not have sufficient levels of that drug in your system to have a therapeutic effect. Conversely, if you're breaking it down too slowly, you might have too high levels of a drug circulating in your system, which can lead to toxicity or other sort of adverse sequelae.
And it's fairly common for people to carry one of these drug-reactive gene variants, right? When I saw the statistic, I was surprised, and now I'm trying to remember what that was.
Yeah, these types of variation are much more common than the types of variants that cause sort of rare genetic disease. Many studies have found that more than 90% of people actually carry an actionable pharmacogenomic variant. So that's a variant that's associated with a clinically actionable guideline, and that's been reinforced by multiple studies that have found 90, 95, even 99% of people carry these types of variants. So PGX testing is really something that's applicable to almost everyone.
Yeah, certainly. I mean, that's crazy to think that it affects that many people, that if they do this testing, it could change either the drug they're being prescribed, if a doctor's choosing from multiple drugs, or like how much they're being given in terms of, are they getting the 10 milligram, or are they getting the 15 milligram, whatever that is. So it's really interesting that this is such an area of like personalized medicine that is quite new. So a lot of people are not aware of this. And one aspect that you brought up before was an adverse drug reaction. What is that? Is that having too much of the drug in your system and having a response to that?
Yeah, so an adverse drug reaction is just any sort of injury or adverse outcome related to taking a specific drug. Estimates vary, but it's estimated that about 15 to 30% of adverse drug reactions are related to underlying genetic variation. And adverse drug reactions are very common. I think they're the fourth leading cause of death in hospitalized patients, and they cost the healthcare system billions annually dealing with them. So it's something that occurs quite frequently, has a significant negative impact for patients, and also just increases the amount that needs to be spent on healthcare.
Yeah, I think most people in the future will end up doing this testing just because of everything we're talking about, of being able to prevent these adverse drug reactions that can be deadly, as you're saying, and that it's common to happen, unfortunately, but also just to get the right drug. Maybe you're taking a drug, but it's not as effective as another drug could be. So, it's certainly interesting to see that, and that we might be having everybody do this. Like, I'm thinking in the future, like, is this going to be part of newborn screening or something? So that, and it follows us of like, okay, we'll see that doctors just bring up your report and say, oh, I'm not going to prescribe you this. I'm going to actually do this one instead. That maybe that's the deciding factor of both these drugs I would prescribe to someone, but I'm going to lean towards one because of the genetic testing.
Yeah, and I think that would be something I'd hope for would be sort of broadly available to everyone in the future. This would be something where whenever your doctor would be prescribing you a medication, they would have your pharmacogenomics results available to inform that decision. I think that's still pretty far off in the future, as sort of broad scale preemptive screening with PGX is fairly limited right now. But I can definitely see that being something that we move towards in the future, given that the testing is very informative, very impactful, and is applicable to so many people and for so many types of drugs. Another estimates are that 40 to 60% of people are actually prescribed a drug that has clinically actionable PGX guidelines. So it's not just that people actually have this genetic variation, it's that they have the genetic variation and they're actually coming into contact with these drugs. So these aren't sort of super rare or specialty drugs. These are really commonly prescribed drugs across the healthcare system in a wide variety of therapeutic areas.
Yeah, I think that's a really good point. It's not just that we carry a variant and maybe someday we'll come across a medication. I mean, most people are on some kind of medication, especially if we're looking at someone's lifespan. Whenever I think of pharmacogenomics, the first thing I think of is psychiatric medications, because a lot of us, if we've seen a psychiatrist and talked to them, or a family member has, we understand that it's a lot of trial and error. They say, okay, these are your symptoms. Let's try this one. Check back in a few months, see how you're doing. And now maybe this is changing a little bit. I have heard of some psychiatrists starting to use, and social workers and therapists that kind of work with psychiatrists of private practices and whatnot, using some of this information to help guide them with some of the psychiatric medications. Are there any off the top of your head that you remember in terms of ones that can be associated with genetic variants, or just SSRIs in general, maybe?
Yeah, so PGX screening related to psychiatric medications is broadly applicable to tricyclic antidepressants, selective serotonin reuptake inhibitors, very commonly prescribed drugs that we've probably all seen commercials for, like Zoloft and Lexapro, things like that, and these are all related to clinically actionable guidelines where if you have a specific metabolizer status for one of these genes, there are recommendations on what dose to start you at. It might not be the exact perfect dose. There might still be some fine-tuning that's required, but hopefully by having this sort of preemptive PGX information, it can help people sort of start in a better place rather than having to try different drugs that might not be effective, or try doses that if you knew about their underlying PGX variation, you'd know that there just wouldn't be the opportunity for that specific dosage to be effective for them. So hopefully it can really cut down on the time it takes a person to and their physician to find the appropriate regimen that's effective for them.
Yeah, I think that has a huge impact, because it can take people months, maybe even years in some cases, just to figure out like what is that perfect medication or a combination of medications. And it's almost like this is another tool in the toolbox. It's not necessarily that this is like just do the test and prescribe based off that. You're looking at other factors too, but I would say it's a really good tool to have to start going off of in terms of, this medication for psychiatric medications. Is there any other types of medications that are known to be affected by our genetics, at least that we've discovered so far?
Oh yeah, it's all the way across the sort of the healthcare landscape. Some really impactful examples are in cardiovascular health. Some of the most commonly prescribed cardiovascular drugs, things like statins, which are used to treat high cholesterol, an extremely commonly prescribed drug. Plavix, which is an antiplatelet medication used to reduce the risk of heart attack. Warfarin, which is used in the management of blood clotting and bleeding risk. These are all cardiovascular medications that are associated with specific clinically actionable guidelines. So cardiovascular health is an area where there are a lot of well-known, well-described PGX interactions. So another clinical area where PGX testing is extremely pertinent is in oncology. Many chemotherapy drugs have PGX interactions, and some of those can actually be extremely serious and potentially fatal if someone is given a specific type of chemotherapy that they have a high risk for. So determining which of those patients are at high risk for really severe toxicity can be life-saving in some cases.
Yeah, I think warfarin was probably the first one I learned about, like in grad school. Like I think that one comes up in presentations a lot, and I think that gives us almost a historical context of this is not brand new. It's brand new in some areas of healthcare, but we've been doing this for quite a bit of time in terms of certain medications where we say, all right, we've got to check either before prescribing or that it helps, especially as you mentioned, like in the cancer space, that we're doing a lot of genetic testing. In some cases just to learn, okay, is there a predisposition to cancer? That's a whole nother conversation, but also like, okay, what drugs are going to work best for the type of cancer you have? So I think that's a good overview of just how many different areas and examples of what this can go into. PerkinElmer Genomics is a global leader in genetic testing focusing on rare diseases, inherited disorders, newborn screening, and hereditary cancer. Testing services support the full continuum of care from preconception and prenatal to neonatal, pediatric, and adult. Testing options include sequencing for targeted genes, multiple genes, the whole exome or genome, and copy number variations. Using a simple saliva or blood sample, PerkinElmer Genomics answers complex genetic questions that can proactively inform patient care and end the diagnostic odyssey for families. Learn more at PerkinElmerGenomics.com. Did you know that genetic testing can pinpoint the cause of inherited retinal disease in about 60 to 70% of cases? Identifying the disease-causing gene mutation can help individuals qualify for a clinical trial for an emerging therapy, many of which now are gene or mutation-specific. The MyRetina Tracker program offers no-cost, comprehensive genetic testing and counseling to eligible patients in the U.S. for inherited retinal degeneration. The MyRetina Tracker is designed for people with a clinical suspicion or a diagnosis of a retinal dystrophy. Blueprint's MyRetina Tracker program panel includes 351 genes and assessment of non-coding variants. The panel has excellent coverage of the RPGR-ORF15 region, which is critical in retinitis pigmentosa diagnoses. And here's a bonus, the panel includes the maternally inherited mitochondrial genome. Stay tuned for our interview with Blueprint Genetics about the MyRetina Tracker program and the patient registry being established on a future episode of DNA Today. In the meantime, you can learn more at blueprintgenetics.com. Again, that's blueprintgenetics.com. We're highlighting all of the great aspects of this. So I have to ask, are there limitations of pharmacogenomic testing, like especially at this point?
Of course. So as I think you alluded to earlier, just because you do the PGX testing and you look at the guideline and it suggests a specific dose or suggests that maybe a specific drug might be more appropriate than others, it can't tell you everything. So another significant cause of adverse drug reactions are drug-drug interactions. So besides drug-gene interactions, you have to take drug-drug interactions into account, drug-food interactions, things like that. And sometimes when you do the PGX testing, it might say, perhaps this individual shouldn't be taking this medication because there's going to be adverse effects, but it might be the only drug that can actually treat them. So it gives us, I think, like you said, a good starting place, a good, better understanding of how a person might metabolize the drug. But in the end, it's kind of the whole picture that needs to be taken account by the ordering provider, the prescriber, to how to best treat the patient.
Yeah, I think that's a really good point in saying just because it comes up like it's not recommended to take this drug, it might be the only one. And you're like, well, should I just be unmedicated or be medicated? So sometimes I think that's a good point of like, it's not going to be the, total like, all right, this is what we have to follow. If physicians are looking at ordering this type of testing, I imagine different tests have different number of genes that are actually analyzed. So kind of in my mind, I was comparing it to carrier screening, where sometimes you look at just a couple conditions, sometimes it's hundreds. Is that similar for pharmacogenomic testing, where you could just look at a few or a ton? Like, what are some of the biggest panels that you're aware of in terms of just healthcare providers? And then we'll kind of get into the patient-directed testing.
Yeah, so, there's kind of a spectrum of PGX offerings, as you might imagine, given that there are wide ranges of the number of genes that get tested for in other types of panels. So there are only about 20 or so PGX genes that are associated with clinically actionable guidelines that are put out by a group called CPIC and or which are described by the FDA as having sufficient evidence to sort of inform therapeutic management. So when people are looking just for genes and variants that have clinical implications that say, if you have this, do this, it's around 20-ish genes that are kind of related to that. Now, there are a large number of genes that do have a significant amount of evidence that there are these sort of significant interactions that might occur, but which are not included in a clinically actionable guideline. And so I've seen panels, that are 40, 50 genes or so, where it's not like these are just made up sort of interactions. They're high evidence, but they might not be associated with a clinically actionable guideline. And then if you think about some specialties, some providers only want to be ordering testing for genes that are kind of specifically related to the drugs that they might be prescribing. So you might see smaller panels, like 4 or 5 genes specifically that might have an impact for their specific patient population. So anything from a few to about 40 or 50 are kind of the most commonly seen sizes of PGX panels.
And I didn't know that only about 20 actually have clinical recommendations where, okay, you have this result and then there's steps to follow. In terms of how you're prescribing or not prescribing. But interesting to know, it's like for those other ones, I'm sure that it will be added over time. We just have to have enough of the data so that we can make those clinical recommendations. But that's always interesting to me, like why something's on a panel or not on a panel. And I think that's a great way of describing it, just to say like some have those clinical recommendations and some it's like we have a lot of research, but that would make it harder for a healthcare provider to take that information and say, okay, what am I going to do with it? So that's good for people to know if they're looking at different panels. Fulgent, under Picture Genetics, offers some of this pharmacogenomic testing called Picture Genetics PGX. Can you talk a little bit about the conditions? Is it 20? Not conditions, the genes that are included. Is it like the 20 you mentioned, or what's on your panel?
Yep, so we offer through Picture Genetics an 18-gene panel, which is only related to PGX associations that have clinically actionable guidelines. And we've decided, that that's probably more appropriate for this type of testing, where it's people who are, actively pursuing being interested in this PGX information, and really only referring back to them the information that has sort of a well-described clinical impact.
Yeah, that makes sense, especially because it's patient-driven. So people that want to order it can just go on your website, picturegenetics.com, and order it. They don't need a healthcare provider to order it. But one of the things I love about you guys is you include genetic counseling, which, I don't think we'd even be doing this interview if you guys didn't include genetic counseling. But how does that work? Do patients have to sign up to have a genetic counselor? Does a genetic counselor contact them? What's the workflow there?
Yeah, and just to clarify, there is an ordering provider involved through Picture Genetics. It's a third-party physician that reviews the test orders to make sure that it's appropriate and reviews the results before they're sent back to the patient.
Yes, so, thank you for clarifying that.
Just because, so there is definitely a medical provider who's involved, and then the genetic counseling is available to anyone who takes the Picture Genetics test. So that they can have the results explained to them, what the impact is. And I think perhaps one of the most important things about genetic counseling related to PGX testing is that only the ordering provider, only the patient's doctor should be making any changes to any dosage or drugs. So people, when they get PGX information back, shouldn't just make any decisions by themselves about, I should stop taking this drug, or I should change the dose. Only an ordering provider can do that, and I think that's something that's always very important and which is communicated through the genetic counseling after PGX testing.
Yeah, very helpful to have a genetic counselor just explore the report with the patient and walk through it and answer those types of questions, and for patients to be able to bring their report in to their physicians and say, if this is a medication they were thinking about going on, or if they're looking at changing medication, and starting that conversation with this is a piece of that. How often do you see healthcare providers ordering pharmacogenomics? If someone does this testing on their own through Fulgent and then brings it into their healthcare provider, do you think that they're going to understand and be aware of pharmacogenomics, or is it kind of more it's on the newer end?
Yeah, I think there's, as with anything in healthcare and especially genomics, there's a wide variety of experiences and knowledge. I think it's something that's gaining significantly more traction than in the past, but it's still not something that's, I'd say, pervasive or widespread. And I think one of the reasons for that is that there are currently really good clinical guidelines about how to use PGX data. What do the results mean? How should they change patient care? But not necessarily recommendations about when to order PGX testing. And I think, as we've seen with hereditary cancer testing or things like that, providers are really going to, I think, be waiting for guidelines to tell them that this is testing that they should be ordering, when they should be ordering it. And I think until those sort of guidelines are updated about when PGX testing should be used, not just how it should be used, I think we won't see as much of an uptake in PGX testing as I think might be beneficial for the general population.
Yeah, that's interesting that once those recommendations are made by like the big organizations, then there's probably going to be skyrocketing of people, healthcare providers ordering this. Have you heard of the Blueprint Genetics My Retina Tracker program? This program offers eligible patients in the U.S. no-cost comprehensive genetic testing and counseling for their inherited retinal degeneration. The My Retina Tracker program panel includes 351 genes, mitochondrial DNA, and non-coding variant assessment. Stay tuned for our interview with Blueprint Genetics about the My Retina Tracker program and the patient registry on a future episode of DNA Today. In In the meantime, you can learn more at blueprintgenetics.com. Again, that's blueprintgenetics.com. Did you know PerkinElmer Genomics was one of the first laboratories to offer whole genome sequencing on a clinical basis? Whole genome sequencing can maximize clinical diagnostic yield for patients. With a turnaround time of 6 weeks, PerkinElmer's whole genome sequencing test is designed to provide access to additional valuable information compared to an exome. PerkinElmer Genomics provides one of the world's most comprehensive programs for detecting clinically significant genomic changes. PerkinElmer Genomics delivers knowledge that can empower health. PerkinElmer is a global leader committed to innovating for a healthier world. Join their mission at PerkinElmerGenomics.com. And also, stay tuned for our interview with PerkinElmer, where we're going to be exploring the power of whole genome sequencing. I'll also tease that my guest for this episode is a world-renowned geneticist, so you are not going to want to miss this one. But while you wait for the episode, head over to PerkinElmerGenomics.com to start discovering all PerkinElmer has to offer. That'll be interesting just to look out for once that happens, how widespread it's going to become at that point. Are there any other roadblocks that you see, impacting this widespread use of pharmacogenomic testing?
Yeah, I think sort of historically there's been a bit of a strained relationship between the FDA and people who want to implement pharmacogenetic testing. The FDA has kind of said, medications are our purview. No one should be doing anything unless it's specifically written in the drug label, and anything else sort of is kind of outside your kind of scope of practice. Now, in the past year and a half, time's flying here, but they did actually come out with a whole list of high evidence gene drug variants that they do consider to be actionable. And I do think that was a really great step forward for the FDA, demonstrating that they do think that these are important interactions, that they can have an impact on a person's health. But I think the next step would be sort of the promotion of ordering the actual PGX testing, not just saying that these are high evidence associations that can be used.
That's interesting. I'll have to take a look at that. We'll link to that in the show notes too for people that are interested in that. Are there other areas of healthcare that you see pharmacogenomics expanding into? Like we talked about, psychiatric is a big one, and that in the cancer space, cardiovascular. Are there any that you see it's not quite there yet, but that might be the next step?
There are, I think it's kind of the way I'd like to see it is it's just not limited to a single clinical area. But more that it's something that's kind of ordered up front and is used to inform sort of all medication decisions going forward. And it's not just, because you came to see a cardiologist, you get PGX testing that's applicable to cardiology. I think that this will eventually be something that is hopefully offered to everyone. And not just sort of in specialty centers when they're prescribing very specific things. So I think the biggest area of growth for PGX testing is just in general population screening.
Yeah, of maybe people even going to see their general practitioner and meeting with them, and maybe they'll be ordering that in the future too, which obviously has the biggest impact if it's going to be in that general space. If people want to learn more about the test that you guys offer, the Picture Genetics PGX testing, where can they go to check that out and order the kit if they're interested?
Yeah, they can go to the Picture Genetics website, which is picturegenetics.com, and they can learn all about the ordering process, the workflow of getting a kit, how to send it back, how the genetic counseling process works, and they can get all of that through our website.
Yeah, and you can also use code DNA today to get 25% off and free shipping. So don't want to miss out on doing that. And you guys are also quite popular and active on social media, on Instagram and Twitter specifically. So you guys can follow them at Picture Genetics. And you can just search Picture Genetics on Facebook. Thank you so much, Greg, for coming on the show and just sharing so much. I learned things in this. I still can't believe you said like 90% of people have a variant that is drug reactive, which is just wild to me. And maybe it's even more than that. You said like some studies are saying 99%. So I think that's something that sticks out to me in terms of just how common this is and how it really virtually can be affecting everybody in types of medications we're taking. So I think this is an area of genetics to be looking at and seeing how things change, because just in the few years that I've been in the field, I have seen this grow, as you're saying, just in terms of how many genes that we're looking at and how many medications are, being affected by this. So thank you so much for just sharing your insight on all of this.
Yeah, thank you so much for having me on. And hopefully we'll continue to see the growth of pharmacogenomics positively impacting patient care in the future.
Yeah, we'll have to have you back on and say, okay, now what's new about this? All right, thank you so much.
Thank you.
For more information about today's episode, visit dnapodcast.com, where you can also stream all episodes of the show. We encourage your questions, comments, guest pitches, and ideas. Send them all into info@dnapodcast.com. Search DNA Today on Twitter, Instagram, YouTube, Facebook, so you can connect with us there. And a favor, please rate and review the podcast on Apple, Spotify, or wherever you listen. This truly helps us climb the charts and allow more genetic nerds like yourself to find the show. DNA Today is hosted and produced by myself, Keir Deneen. Our social media lead is Corinne Merlino. Our video lead is Amanda Andrioli. Thanks for listening, and join us next time to discover new advances in the world of genetics.
The genes of you and me, the genes of you and me, they're all made of DNA. We're all made of the same chemical DNA.